Good afternoon, everyone. This is Dr. Shakti, Associated Physiotherapist with Just for Hearts, having 4 years of experience in clinical academics, practicing owner at Move On Physiotherapy Center, Noida. So I welcome you all on this live session on World Alzheimer's Day. So I think many of you must have heard about the World Alzheimer's, but many of you must not have heard what is the meaning and what exactly is Alzheimer's. Okay, so I think we have more number of old age people, old age group in our society who once in their lifetime experience a lot of loss of memory or loss of recollectness in their life. But have you thought of it? Have you given a thought on this, that why does it happen and what is the cause, exact cause for it? We usually give it a title that it's because of old age, but behind the old age we have a word called Alzheimer's, which is associated with that. And today I'm here to discuss some insight into the world of Alzheimer's and the role of physiotherapy in Alzheimer's disease. Okay, so I think we'll start with the slides. Okay. So first is we need to understand what is Alzheimer's. Alzheimer's disease is a progressive disorder which is the most important cause of dementia. Okay, now I think the word dementia is very familiar to you. That is loss of memory. Okay, as we grow old, we usually tend to lose our memory. We tend to lose to memorize many things in our lives, like reading, writing, or recollecting many people's name, or oh, this is the address, or many things. But this is the word called dementia, which is actually one of the most important factor that has to be taken into account when we see old age people. And Alzheimer's disease is a progressive disorder, which is one of the most important cause which leads to dementia. There is loss of neurons in the brain, and also changes in the brain tissues are also seen. Okay, so as it associated with the neurological system in our body, so the neurons, which are the connecting link or the connecting link in the synapses which occur in the brain, and are also associated with this disease. And there are also a lot of changes that occur in the brain tissues are also seen. Next, we will come to the risk factors. What are the risk factors, or what are the things that has to be taken into account when we come to the world of Alzheimer's? Mostly, as I said, it occurs in the age group of above 60 years. Okay. Also, we have seen in very rare cases that many, young, that is around 30 or 40 to 50 years, within the 50 years of age group also, they also suffer from a lot of, loss of memory and such associated things, but we cannot name them as Alzheimer's as such. But when the age group of 60 years is coming, then we can see that yes, Alzheimer's that is can occur during this age group. Second is it can be hereditary in nature. Okay, it can run in the family as well. We take the history of a patient when they come to the clinic, and we usually ask the first question: is there somebody who is there in your family who is having this disease? Or you must have be knowing anybody who is there, so that they can collect and they can tell us that yes, it is there in our family or not. So it might be hereditary in nature as well. Next, if there is a history of brain injury. Okay, so sometimes what happens, many people suffer a lot of incidents or accident in their life, and brain is one of the most important part of our body which gets affected mostly. So because of the brain injury also, there might be a cause of loss of memory. There might be a injury to many part of your brain. As I mentioned earlier, there is loss of neurons in the brain. During an incident or during any brain injury also, a lot of brain changes, a lot of brain tissue changes are also seen. So there also we can see that Alzheimer's disease can also happen because of any kind of brain injury also. Next, come to if there is any cardiovascular risk like obesity, hypertension, diabetes, or mellitus. I think I can tell this that this can be some of the secondary things. The hereditary, the age group, the brain injury can be the first sign or the first risk factors. The secondary risk factors can be cardiovascular diseases like obesity, hypertension, diabetes, mellitus, which can lead to Alzheimer's disease. Next comes to the sleep disturbances. Okay, we have seen a lot of people who are having actually diabetes, hypertension. and everything. They also have disturbances in the sleep pattern, the sleep wake cycle. Some day they get the full amount of 8 to 9 hours of sleep, and some day they actually do not get even only 5 to 6 hours of sleep also. Because of that also, there might be changes in the neurons in the brain, which can lead to Alzheimer's. Next, we'll come to the thyroid disturbances. Okay, we know that in thyroid disturbances, there might be hypo or hyperthyroidism. Many people are having hypo, that is decreased in the high thyroid level. There might be increased in the thyroid level also. So if there is the thyroid level is not optimum, that there is a certain level, or there is a certain, we can say a calculation where the thyroid level should be at the optimum. If it is higher or below it, that might also lead to Alzheimer's. We'll go to the next slide. Okay, so now we know about what are the risk factors which are associated with Alzheimer's. Next, I can share one thing with everyone, that the cause of Alzheimer's. Many people will ask me, what is exactly the cause? There will be loss of neurons in the brain, there will be brain injury, there will be cardiovascular diseases. But what is exactly the cause? I can say the cause is etiological. Then what is etiological? The cause of the Alzheimer's is yet unknown. It is not exactly known by many of the scientists or many of the healthcare professionals that why Alzheimer's occurs. But because of these risk factors, I can say that leads to Alzheimer's disease. Next, now we will come to the warning signs of Alzheimer's disease. Okay, what are the signs and symptoms that are actually occurring in a patient or occurring in a person that will give us, or that will give us a point where we can tell that okay, this person is suffering from Alzheimer's. First is the forgetting recently learned information. Okay, now this first point cannot be the sole warning sign for Alzheimer disease. There are a lot more warning signs, but the first sign can be the person will tend to forget many things. As I have mentioned, they will tend to forget learned information that they have learned at least within 2 to 3 hours back. They must have learned about somebody's home address, or they have must have read something in a newspaper. They must have known somebody's a new person who's coming to their house. They must have asked their name, but they tend to forget. We tend to ask them what is his name, or have you heard, or have you can you recollect the person's name? The patient will be unable to answer you. That is forgetting recently learned information. Next, we'll come to repeating words or phrases very frequently. Okay, this is another warning sign we can see in many patients. They will tend to repeat words again and again and again. Once they have seen that, okay, this is a word they must have read in a book or a paper, then they will try to, they will try to repeat that word again and again while they are talking very normally with anybody, while they are talking with, their fellow, their anyone in the phone or anything. They will tend to repeat those words again and again and again. Next, come to difficulty in solving any problem. Okay, so problem is a thing that that occurs in everybody's life. That might be any physical, psychological, or any kind of mathematical problems also. In case of any bookish thing, what we say. So the patient of Alzheimer's disease, they find it very difficult to solve any kind of such problems. Such kind of problems, in the sense, once we ask that, okay, if you're having a back pain or not, if you're having any neck pain or back pain, just tell me what you're trying to feel. Just tell me your problem. They won't be able to answer you. It becomes quite difficult because they are not able to recollect exactly what is happening with them. This happens if somebody, we have our grandparents, and grandparents, they are living with their grandchildren. They need the grandchildren ask their grandparents, okay, grandma or grandpa, tell me this mathematical, can you help me out in solving this mathematical problem or something. It actually becomes quite difficult for them to go through the book, to go through bit by bit the lines and everything, and to solve this problem. So this is also a very, it creates a very chaotic situation when the person becomes very confused. He is unable to understand what exactly is the problem and how he is going to solve it. Next, we will come to difficulty in concentrating and loss of focus on important issues. Okay, so as we know that the person is not able to, not able to solve any kind of problem which is coming in their life and everything. So it is very obvious that he won't be able to concentrate on a particular thing, right? Like having lunch, having dinner, having breakfast on time. They will tend to skip at least 1 to 2 hours after or before that. They will be thinking, okay, is this a time for me to take the lunch? Is this the time for read the newspaper? Is this the time I need to go for a walk? It actually becomes difficult because they are not able to focus on the important issues. They are not able to concentrate on the particular thing which is very important in their life, but yet they tend to forget that. That becomes very difficult for them to, for the daily activities that they are going through in everyday basis. Next come to the difficulty in identifying place, date, time, occasions, or any daily task. As I mentioned earlier, the patients find it very difficult to memorize things. There is loss of memory. So obviously, they will find it difficult in identifying any person, any relative any person who is coming to their house. If you have a neighbor who is coming frequently to your house, but one day all of a sudden the patient will tell, who are you? I don't know you. Sometimes this also occurs, and we actually find this clinically. We have seen a lot of people, they will be coming to the clinic for a regular checkup or something, but all of a sudden they come up, okay, oh, you're my doctor. Okay, you're treating me. So this kind of sentences are, we tend to hear from the patients of Alzheimer's. So it is very much difficult for them to memorize places, memorize date or occasions, or all the activities they are doing every day on a regular basis. Second, or last thing we can say, there is difficulty in reading, writing, or judgment. Yes, as I said, that the judgmental power, if you ask a patient, okay, can you tell me what is the difference between this and this? If we ask the patient of Alzheimer's that, can you tell me, can you show me what is exactly there, or can you tell me what is written on the book? Can you write this sentence for me? No. Sometimes the patient becomes very, they try to, they try to stand still. They're not able to tell anything. When we see clinically a patient coming to a clinic, we ask these kind of questions first. Okay, can you tell me what is written on the book? Can you tell me where? Can you tell me what is the difference between and this and that? They are not able to answer us. Why? Because there is loss of memory. They are not able to identify things. They are not able to read. It becomes quite difficult for them to frame a sentence, frame a word. So that becomes really quite difficult. And as it is a progressive disease, it keeps on progressing day by day. It keeps on progressing day by day, and we have to arrest it as fast as possible to stop the progression of the disease. Next, we'll go to the next slide. Okay, so first we have learned about what are the warning signs which are associated with the Alzheimer's. Now we'll come to the secondary complications which can arise because of the Alzheimer's, and because of which physiotherapy is very important in this disease. First is there might be loss of balance and coordination. Okay, so we have a normal biological system where the brain controls everything. The brain has got, that is the parent organ which is controlling all the neurological system in our body, all the peripheral systems, or the musculoskeletal, all the neurological system in the body. So because of loss of memory or because of the changes in the brain tissues, there might be loss of balance and coordination as well. We have seen a lot of patients in Alzheimer's, they find it very difficult to walk. They will not be able to put every step in a coordinated manner. They will tend to fall. They will tend to support something and they walk. They will not be able to walk independently. So there might be, loss of balance. They might be, they might be stepping somewhere into the right, somewhere into the left side, and they won't be able to, walk without any support. They need some assistance like any stick or anybody's help or something. Next, we'll come to the loss of muscle power, brain tissue loss and muscle property entire body. I think this is the common thing which is, I have been reading throughout from the beginning, that there is brain tissue loss. There is loss of brain tissue and there is loss of muscle property in the entire body. Okay, when there is loss of balance, when there is loss of coordination, so obviously the musculoskeletal system will also get affected. And in the musculoskeletal system, the muscle power, the muscle is the building block, it is attached to our bones, it is helping us to take steps, it is, it is also forming the joints in our body. There is loss of muscle power, there is loss of muscle, bulk, there is loss of muscle properties in the brain and in the entire body, we can see. Next, we'll come to the reduced muscle strength and activity. Obviously, when there is loss of muscle power, when there is loss of muscle property, then the associated things like muscle strength and the muscle activity also gets reduced. Muscle strength in case of upper limb, lower limb, the trunk, and the muscle activity like, bending of your elbows, extending, hunching forward, backward, stepping forward, backward, that becomes difficult, and because of that, there is reduced muscle strength and activity. Next, we will come to the loss of range of motion in joints and movement. That's very obvious when there is muscle, strength and activity is reduced, there is loss of muscle power. As I said, there will be loss of range of motion in joints and movement. In many patients, we can see there is, reduced, or there is, slowness in their walk. We have a normal cadence, that is normal step length or the stride length that we take when we walk. But in case of Alzheimer's patients, we can see there is reduced range of motion. The optimal amount of joints motion which has to be found, that is not there. There is loss, or that there is reduced, and slowly it will gradually progress in that manner. And there is reduction in movement as well. They won't be able to get up from the chair easily. They won't be able to, move forward very fast. They won't be able to take a quick step like that, like a normal person, because there is loss of muscle strength and muscle activity. Next, we'll come to reduction in frequency of daily activities. Because of the above mentioned points, I think there will be reduction in frequency of daily activities. They won't be able to do brushing their teeth, combing of their hair, eating food. There will not be any normalcy in their frequency. There will definitely reduction in that. When we take a history of a patient, these are also the things we take into their history accounts. How are you able to brush your teeth? Are you able to get up from the bed? Are you able to take your food easily? There will definitely a reduction in all this kind of activities. Next, come to the musculoskeletal issues like joint pain, muscle fatigue, bone deformity like arthritis and back pain. Because of all the musculoskeletal main issues that are arising because of the muscle, the joints activities and everything, there will be some other small issues that might arise like joint pain, muscle fatigue. The patient will always have some kind of tiredness, fatigueness in their muscles. They will feel, no, I'm having some pain in my forearm muscles. Sometimes I'm feeling very much, there is back pain when I'm getting up from the bed. It becomes quite difficult for them to stretch their body. There will be some stiffness in their joints. There will be some bone deformity like arthritis. Usually there will be arthritis in their hands. These, the fingers, the joints in the fingers which are present in our body, they are mostly affected. They won't be able to hold the spoon. They won't be able to hold a pen. They won't be able to hold anything like a bottle I'm holding like this. It becomes quite difficult for them because there will be loss in balance also. There will be loss in balance. There will be loss in coordination. They won't be able to hold a bottle like this. There will be some trembling in their hand. They will be holding like this. They will be holding like this, but not perfectly. But these signs are not found in every patient. In some patients, these warning signs can be found very early, and sometimes it is found very late. These occurs very late in the disease form. Next point. Okay, next is the neurological issues like radiating pain in the upper limb, lower limb, cervical region, lumbar region. Okay, so as I mentioned that because of the warning signs or because of the loss of brain tissues or properties, there might be musculoskeletal and as well as there might be neurological issues like there might be radiating pain in the upper hand. Okay, if a person, if you try to make a patient of Alzheimer's stand straight and you will ask them, what are you feeling? How you're feeling in your in your upper body from your neck to shoulder to elbow, everything. Some patients will tell you that we find some radiating pain from our neck to our hand region. That is there is a radiating pain that originates from the back of your neck that radiates through entire hand up to the pulp of your finger. Many patients will complain of you that why it happens. That's very obvious that there because of the changes in the brain tissue, there might be squeezing or there might be alterations in the neurons. There might be strictness in the neuronal arteries or the nerves that are arising from the occiput region, that is the back of our head, which is arising. These nerves which are arising, that will get affected, and because of the compression or something, there will be some tingling sensation. There might be a stretching effect that they will get usually from their head up to the pulse of the finger, the entire. Next, we will come to the same thing that will arise. That same thing happens in the lower limb, that from the hip region, from the pelvis to entirely up to the foot region. They will also get some radiating pain, and in the cervical and the lumbar regions. Cervical, obviously, this is the direct, the curve which is present, or the joint which is present just below our brain, that usually gets affected. This is the cervical region which I am talking about, and the lower back is our lumbar region. So obviously, when you're getting a radiating pain, you will get some pain in your cervical region as well. When the nerves are passing from your entire body, your upper limb, your trunk, and the lower limb, that's very obvious that you will also get pain in your lower back. As I'm standing here, I can say this is your lower back. People usually complain of they have a radiating pain from the side of the head, side of the lower limb, or exactly at the back. This is the back region. They get here, they get a radiating pain here, they get a radiating pain in front of their leg as well. Okay, so we'll go to the next point. There is reduced number of steps taken while walking. As I mentioned earlier, that it becomes quite difficult for a patient of Alzheimer's to walk properly because there is loss of balance, there is loss of coordination. So definitely there is a normal range when a normal person takes a step, one after the other, that is reduced in case of Alzheimer's patients. It becomes quite difficult. We see as fast as possible a normal patient will tend to walk, but when we start comparing two people, a normal and Alzheimer's patient, the Alzheimer's patient will find it quite difficult to take that normal cadence or normal step length as compared to the normal one. Next, we will see there is frequent falls while walking independently. Definitely, when there is loss of balance, there is loss of coordination. There will be difficulty while walking, and they have a tendency to fall very frequently. So they need some support like cane or some stick, or somebody is there in their house or somebody nearby. They will tend to hold their hand and walk. Then the last one, there is difficulty in breathing. When we have seen that the entire system of the body is getting affected by the Alzheimer's, so obviously the respiratory system also gets affected. They have difficulty in breathing while sleeping, while lying down. They want to keep as many as pillows as possible at their backside so that they can lift up their head and they can support it easily so that they can freely breathe. They can inhale and exhale freely. So obviously it becomes quite difficult for them. This difficulty in breathing usually occurs in the latter stage of Alzheimer's, and maybe it gets worsened up if it is not arrested as early as possible. Okay, so we'll go to the next slide. Okay, now comes the role of physiotherapy. We have heard of a lot of things. What are the warning signs? What are the secondary complications that are arising? So why physiotherapy is required? How physiotherapy can help an Alzheimer's patient? Because when we go to a doctor, he prescribes all the medicines, everything, the do's and don'ts and everything to do. Plus, besides the daily medications and everything, physiotherapy also plays a vital role in, reducing the progression of the disease, and also it helps the patient to live a very, pain-free life, so that they are able to carry out all their daily activities very easily. First, balance and coordination exercises on Wobble board, walking on ramps, stride walk, balance activity on the gym wall. These are the kind of exercises that can be performed with the Alzheimer's patient. Balance and coordination exercise. I think I have got a slide at the end where there is a Wobble board. Can we see the slide? Yes. This is a Wobble board. Usually, this kind of boards are available in the physiotherapy department, where we can see that we make the patient to stand on the Wobble board, and we try to make them balance. That because the base of support is very small, so it is quite difficult. But yet, it is a kind of exercise that is fun for the patient, and also it helps to improve the balance and coordination. We try to make the patient stand on it and tilt it from side to side, from left, right, forward, backward, and forward, backward. But remember, you have to support the patient completely throughout the exercise, because the patient tends to fall easily. They have a tendency to for a frequent fall, right? So when you're going for the wobble board exercises, we support the patient completely from all around, and we tell the patient to move from left to right, from forward and backward. These are, and the circular motion on it as well. So it helps them to, to focus on the activity what they are doing, and to focus on their lower limb, so that they will see, okay, my leg is not falling down. I need to balance myself. I need to balance on the small surface which I am standing on. Okay. So next one, next role of physiotherapy: muscle strengthening exercises like active free movements of joints. Okay. Now, active free exercises means the stretching exercises. There are a lot of activities which we prescribe to patients to do at home and to do at the department as well. Like the normal head activity. Like I will be demonstrating right now. We can try to make the patient stand, sits. They can do it in a standing position as well as in the sitting position as well. The normal neck activity they can do, that is forward bending, backward bending, left and the right, forward, backward, left and right. Yes, it seems very easy, but it actually becomes quite difficult for the patient to coordinate and do. That's why we start from a very simple exercises: forward, backward, side to side. These are the neck activities, and this also helps in reduction of the radiating pain that they get from head to the upper limb. Next, we'll come to all the shoulder exercises: normal upward movement, side movement, upward, side and down, upward, side and down, upward, side and down. Very easy, but yet difficult for the patients. Now, standing activities, what they can do, like the trunk activities, what they can do, like forward bending, straight, backward bending, straight, forward bending, straight, and the backward bending. Remember, my only the torso is visible to everyone. That's just because I'm focusing on the trunk activities. Okay. Next, they can do the rotation exercises like wow, left, straight, right, straight, left, straight, right, and straight. So these are some of the exercises or the active free exercises they can do for the upper limb, for the trunk, and the best exercises for the lower limb is walking. When they want to, when there is, the walking is one of the best activity for the lower limb. Anybody can prescribe for Alzheimer's. They can go for a walk outside. They can walk inside their house from one room to the other. They can support the wall. They can ask anybody for any support, or usually they use a cane or a stick. They can hold on and they can walk slowly, slowly, slowly. They can take and improve or increase the number of steps they are taking while covering from one room to the other. We'll go to the next point. Okay. Strengthening exercises with weight cuffs. Okay, so I think I'll show everyone. This is a weight cuff, which I have this with me. This is a weight cuff. Okay, it is usually a bit heavy. I think we can take around 0.5 to 1 kg of weight. And this is the one which we tell the patient to hold on. This gives a resistive, resistive effect on your hand, so that the patient will be able to hold it up, to balance the weight cuff, and to do the activities that we prescribe. We can tie it up around the wrist joint and tell the patient to move your elbow joint, to move your wrist joint like this, like the forward straightening up of your elbow, straight upward, downward movement of your wrist joint, because it usually, this weight cuff can be done for the upper limb activities. For the lower limb activities as well, you can tie up the weight cuff around the ankle joint, and you can tell the patient to straighten up your knee, bend down, straighten up your knee and bend down. Next, we'll go to the next slide, next point. Okay, next is the mirror therapy by exercising for particular body parts in front of the mirror. Okay, so I think everyone must be having a mirror in your house, right? So in the house, these activities I'm telling, keeping in mind that everyone can do at home. And obviously these are done in the clinic or the department where physiotherapists advise all these activities to do during the session. And after the session in at house also, they prescribe some home based activities that they can be easily done at home. So when you have a mirror in your house, right, tell the patient to stand in front of the mirror and do all the active exercises that I did right now, like bending your neck from side to side, front, back, with weight cuff, holding, so that it becomes easy for the patient to see himself what he is doing. It becomes quite easy for them to see that, okay, I'm standing in front of the mirror, I'm able to do this movement, upward, downward, straightening, okay, everything. These are the things that can be done in front of the mirror also, that makes the patient conscious of his body parts. It makes the patient more conscious that he is able to do this. He will not get confused, he will not forget that, okay, what I was doing with the thing, what that is there. He will be able to memorize the thing. When he will see himself in the mirror, he will be able to analyze that this is my wrist, this is my elbow, this is my neck, this is my trunk. Okay, so I'm doing some kind of activities with all these body parts of mine. We'll go to the next point. Okay, modifications in daily activities with reduced loss of energy and effort. Obviously, so as I mentioned, that home-based exercises are also prescribed to the patients. When they go home, we need to make the surrounding or the ambience of the house in such a manner that it becomes easy for the patient to do all his daily activities with, loss of energy. There is a huge loss of energy when they do activity, because there is a much of effort involved in their activity. They are not able to do it like a normal person. So we can arrange some chair, we can arrange some table or the bed in such a manner that they will be able to get their medicines. If there is a rack or a desk which is placed beside their sleeping area, that becomes easy for them to get all the medicines. Because they will find it very difficult to get up to get the medicine from the other room and everything. You arrange the surrounding of the patient in such a manner, in a very friendly manner, so that it becomes quite easy, and they tend to remember all the things. This is the water bottle, this is the thing which is there, I need to keep it. This is my clothes, these are my clothes, this is the book, and everything. You need to arrange his room in a very specialized manner that becomes effortless for the person to do the work. Next point. Stretching exercises for radiating pain, neck, shoulder, forearm, trunk, and lower limb. Okay, so I will be demonstrating some stretching exercises so that these, it becomes quite easy for the patient to do. Like as I mentioned, the neck area, they usually get the radiating pain in the neck region. So this is a kind of stretching exercises where the opposite hand is behind the back and the other hand is upon the head. So try to stretch it on the other side, counting up 1, 2, 3, 4, 5 and release. 1, 2, 3, 4, 5 and release. The same thing will repeat on the other side. 1, 2, 3, 4, 5 and release. 1, 2, 3, 4, 5 and release. Okay, for the shoulder joint, shoulder shrugging is the best and the easiest thing. 1, 2, 3, 4, 5, clockwise and anti-clockwise. 1, 2, 3, 4, 5. Very easy. Okay, because we have to make everything very easy for the patient. We do not tell them, okay, do this with the dumbbell, we do this with the weight cuff initially. You have to normalize the patient. You have to counsel the patient that you have to do some kind of activities with the problematic areas you are having. For the lower limb as well, you can also do the quadriceps, the hamstring stretches which are present, the trunk rotation, as I mentioned in the active exercises, side stretches. 1, 2, 1 and 2. I'm only focusing on the dorsal area, the body, the trunk part which is there. So stretching from side to side, from placing your hand above the other. 1 and 2. And the same thing in the forward and backward manner. 1, 1, release. We'll go to the next point. Breathing exercises can be done for respiratory system problem in patients, that is diaphragmatic breathing, deep breathing through nose and mouth. Okay. So as I mentioned that the respiratory system of the body also gets affected, the breathing becomes difficult for them to do while they lie down, when they get up, or they're in a area, or they when they're eating, it becomes difficult for them to take in the air. So there are some kind of exercises that can be performed by the patient. For after doing that, I think the patients will feel very relaxed. They don't get that problem of suffocation, they don't get that problem of inhaling the air. Most first point, that is the diaphragmatic breathing. The diaphragm which is present, this is the diaphragm which is present just below the sternum. You place your hands like this. You place your hands like this, and you try to inhale through your mouth, through your nose. Release the air through the nose only. While you're performing this activity, you are continuously placing your hand at the diaphragm level. You're placing your hand at the diaphragm level so that you're able to understand how the diaphragm is moving. It is moving forward when you're inhaling, it's squeezing back when you're releasing the air. This is the exercise where there is inhalation and exhalation through the mouth only. Next exercise, I will go to the when there is you need to close your eyes, sit very silently, tell the patient to sit very silently, close your eyes and instruct the patient to inhale through the nose and exhale through the mouth. Okay, so this is easy yet a bit difficult for the patient. So I think this is a breathing activity which we can do with the patient, or which we usually do with the patient, so that they find it, they find it easy for themselves to focus on their entire body. There is improvement in the circulation to the brain, to the entire body, and in a way it helps improving their respiratory or breathing problems. We'll go to the next point. Okay, fun-filled activities with music to improve upon concentration and reduce stress and activity. Okay, so as we know that the old age people, they sometimes becomes they are in stress, they are in anxiety, they find themselves very lonely, they find themselves that somebody should be there beside them to hold their hand, to understand them. And when they have such kind of problems like loss of memory, loss of balance, coordination, everything, there should be a crowd around them. There should be a crowd of at least 3 to 4 people or of their same age group, so that they can do some activities together. These fun filled activities can be done in a group, where there are a lot of centers which are there, where a lot of people do or perform these activities along with the other patients as well, so that they can see, okay, I have somebody beside me who is having the same problem like me. So I'm not the only person in the world who is suffering from this. Yes, there are a lot of other people as well. So there can be, there will be music, there will be some, some spiritual activities. Might be some, activities like, meditation, or as I mentioned, deep breathing exercises, that they can do it together. That can be fun filled for them. There can be, we do usually aerobics with music, like movement of the hands in a dance form, so that can be formed, that becomes easy for them to do, as well as it's fun for them, so that they tend to forget their problem. They will tend to forget entire body pain. They will tend to forget all the, the hardships they are facing because of the disease, and it becomes very easy for them to cooperate, so that they become they may make new friends. That becomes easy for their body, so that the body becomes very relaxed. That they tend to relax their mind and see that I have fellows who are also suffering from such kind of situations, and I'm not the only person who is into this problem. We'll go to the next slide. Okay, so next slide, I've shared, there is a beautiful picture where I see a therapist is supporting a patient who is sitting on the gym ball. There are a lot of centers who are, prescribing these kind of gym ball activities, where The patient is patient is prescribed to do a lot of activities that can be done on a gym ball. Like the patient is sitting on the gym ball, he is trying to support her entire body on the gym ball while making some activities with the hand. Yet the therapist is trying to support from front and back so that the patient does not fall down, the patient गिर ना जाए, so that the patient उसको अपने आप में confidence आता है, so that वो समझ में आता है patient को that he's able to do these activities alone. Because when the time will pass on, we prescribe the patient to do all these activities alone when we see some kind of confidence that yes, he is able to do that. We'll go to the next slide. Okay. So here I can see, as I mentioned, that there are group activities or fun-filled activities which are performed. So we can see two people who are performing together the mat exercises, the active free exercises, what they are doing. So I think this picture shows that it is a belongingness. It is a belongingness that a group activity can give to these patients, and these patients also become very relaxed when they come down to these places. They perform therapies, they perform activities, they perform exercises together with their fellows, and they're smiling. Yes, they all are smiling because this disease is a progressive disease. We never know what kind of situation, we never know what kind of warning signs will come in your near future. So we have to support these kind of patients each and every day. We need to arrest all the problems that they are facing as early as possible. And we can also inculcate these kind of activities in a group manner where they find it easy for somebody to talk with, somebody to share their problem, and they will not have any kind of, memory problem, loss of memory problem. And I think these kind of activities or physiotherapeutic activities will help these patients to overcome their problem and lead a very healthy and beautiful life. So I think I have come to the end of the session. And we'll have any question and answer round where if I can. Okay, I see a question. Can you suggest any exercise or any practice to keep our brain health in good condition? Okay, it's from Neha Gurag. Okay, thank you so much, ma'am, for this question. Okay, so there are a lot of exercises which we can practice for keeping our brain in a healthy position. Most importantly, meditation and deep breathing. These are the two kind of stuffs which you can perform every day to keep your brain tissues in a healthy condition. That will lead to, a healthy musculoskeletal, neurological, and respiratory system. Like the deep breathing, as I mentioned, inhaling through your mouth and exhaling through your mouth, inhaling through the nose and exhaling through the mouth. And meditation, at least 10 to 15 minutes of meditation every day can help you keep your brain in a healthy condition. And also suggest, okay, another question, also suggest that what all things to avoid which can tend to such kind of symptoms. Okay, we never know what these kind of situations will arise in any part of any day or any part of your life, because this is a very deteriorating condition and the cause is unknown, as I said. But yes, if you are into a proper diet, if you are exercising, like taking a walk, doing all the stretching exercises, doing yoga, meditation every day, taking lots of water, and you're having a positive vibe around you. If you have so many people around you where you can, relate yourself, you can tell your problems to anybody, and you're open-minded. If you can share your thoughts with anybody, and obviously exercising every day keeps yourself healthy. It's not for a single patient I'm talking about. If I'm talking about the entire society who wants to get rid of or who don't want such kind of problems to arise in their life. Yes. Okay, so thank you so much for this session. I think we have come to the end. I thank all the viewers for watching this. We'll close the session. Thank you so much.